Yeah, it was an unusual speech for a Korean president to make on a policy issue, but particularly for President Yoon Suk Yeol, who's not known for communicating in publicly or even being particularly articulate in his communication sometime. But this was very different. This was a very clear message that went for almost an hour. And it began with an apology, apologizing that this has dragged on for almost 50 days and that the government hasn't been able to resolve it yet. But President Yoon said he's going to stand firm on that additional number of 2,000 medical students per year, on top of the quota of a little more than 3,000 that currently exists, so more than 5,000 in total. And he would not be flexible on that. He listed lots of statistics. He went through many countries, mostly advanced economies, OECD countries like Japan and Europe, pointing out that among them, Korea spends at the top of the advanced economy average on healthcare, and yet has the lowest number of doctors, or just slightly higher than Mexico, but if you take out traditional medicine doctors, then the lowest in the OECD. And he also pointed out that most of these other countries have almost double or more than double the number of medical students every year that South Korea would have if it added the additional 2,000 doctors. So he said, you know, the number of medical students hasn't increased since 1997. Because of the rapidly aging society here, there is not just a need for more doctors, but many doctors are retiring. And he said, unfortunately, many younger doctors, 600 to 700 a year, are heading off to cosmetic surgery, leaving shortages in other vital sections. And, you know, giving some case examples of in rural areas where many people for basic procedures are waiting up to 1 year to get treatment, which he said is unacceptable. His biggest concern, he said, was even if the 2,000 extra doctors per year go through, it would of course take a decade to come into effect by the time they are trained, by the time they've gone through residency. So he said there will be this sort of shortfall over the next decade, and to fix that, the government's going to invest almost the equivalent of $7.5 billion in medical infrastructure to in some way address this current shortfall of doctors in the countryside and in key areas like obstetrics, pediatrics and emergency medicine here in the city. So, you know, a well laid out speech. Perhaps he didn't need to make it. The vast majority of South Korean citizens are shown to back this policy, to the degree that even the opposition party, which would normally slam any Yoon government policy, has been calling also for the doctors to go back to work without actually praising the policy. So this is close to bi-party support that you're going to get in South Korea. Now, is it going to help? We've got news today that the medical professors who've tendered their resignation are, as of today, going to start cutting back their hours, and that is going to have an impact on things like emergency medicine. In their own words, it will affect outpatient treatment and a lot of surgery. So even as the president has made this call, what we're seeing is the crisis is just deepening further.